Here's Jack Pattie.
Good morning and welcome into the 9 to 10 show for Tuesday. It is the 11th day of August. Dr. Kevin Kavanagh is with us. Good morning, Kevin.
Oh, good morning, sir.
You are the founder of an organization called Health Watch USA. What is that?
Yes, it's a nonprofit organization that advocates for patients and also for transparency in healthcare. Transparency means that patients know what the quality costs are, and as we'll discuss today, also conflicts of interest are within the healthcare system.
We have an A-list guest this morning, and I've never seen you so excited about a guest before. Please introduce her to us.
Well, I really am, and this is Dr. Leana Wen. She is someone who I've known for several years now. Just 3 years ago at one of our Health Watch USA conferences, we were very privileged to have her come and speak as she's starting her career, and little could I have dreamed that she's has one of the highest rated TED Talks, has started as commissioner of the Baltimore Health Department, which is one of the oldest and probably most prestigious health departments in the nation, and has been put in charge of handling one of the toughest public health crises in our nation. In other words, trying to heal Baltimore.
Wow, Dr. Wen, good morning.
Good morning. I'm so pleased to be here with you today and to also speak with Dr. Kavanagh. Thank you so much.
We're just honored to have you. Start us off there.
Well, why don't you start telling us, Dr. Wen, a little bit about what it's like being health commissioner in Baltimore, your challenges, and some of the problems that you're facing and solutions that you're proposing. I noticed in one of the NPR articles that they're affectionately calling you Dr. Went, that by the time there's a problem, you're already gone solving it. Well, let's talk a little bit about that.
Sure, thank you. So we are, in Baltimore, we face a lot of significant health challenges. We talk about health disparities, which means disparities based on where you live, disparities based on what race you are, based on your socioeconomic background. We have people who live just blocks apart who, because of their zip codes, they end up living 20 years shorter than someone else, just based on where they were born, where they happened to grow up. And that's just not what should happen in this day and age. And so what we do in the health department, which I very much appreciate Dr. Kavanagh's description of it, we are the oldest health department in the country. We certainly pride ourselves in being a health department that is very hands-on, very action-oriented, and in serving the needs of our community. And so we want to level the playing field and give every child the opportunity to be born healthy, to succeed in school, and to live healthy and fulfilling lives. So we cover the entire breadth of public health, looking at prevention, looking at home visiting for moms and children, looking at restaurants and inspections, animal welfare, senior care, aging services. That's all part of what we do.
Well, I think the other thing I have known you for is also, and I think that catapulted you to the national attention, is your work that you've done on transparency of conflict of interest. And I mean, you've got a very good TED Talk. For the listeners, TED is an organization which sponsors idea-type talks. They're 18 minutes. You have to go on your computer and Google TED Talk. Mm-hmm. And your talk is not only very informative, but it's also one that really is emotional. And it is last viewed well over 1.3 million views, which is just outstanding. And that, coupled with your book on conflicts of interest, I think is just phenomenal work, especially someone under the age of 60. And, I mean, goodness, how did you ever get started in this? Can you give us a little background to that?
Absolutely. What led me to the area of healthcare transparency, unfortunately, is not a good story because it happened. It's certainly very personal to me. When I was a medical student, my mother was misdiagnosed for about a year until she was finally diagnosed with what turned out to be metastatic breast cancer that by then had spread to her brain, her bones, and her lungs. And I learned a lot in the process of being her caregiver. I saw, because I was going through my medical training at the time, just how much physicians are well-meaning. And nurses are well-meaning. Our healthcare system means to do the right thing for patients and families. But actually what we end up doing is so disconnected, and it makes our patients feel that they aren't part of the process. And it actually isn't just an emotional issue, but it actually leads to misdiagnoses, which is why I wrote my book, When Doctors Don't Listen, How to Avoid Misdiagnoses and Unnecessary Tests, because I wanted to share the lessons that that I learned in the process of being my mother's caregiver, that there are things that we must do as patients to advocate for ourselves and our loved ones, that there are things that we must do to empower ourselves to do better, while at the same time the medical profession is transforming itself, and while we as medical educators and physicians are working on our end to assist with what we can do, but we also have to focus on helping patients to be better advocates for themselves. And transparency is a key part of it, but just knowing that you have to advocate for yourself to get the best care possible is certainly a key component.
I think sometimes the problem is we folks who are not doctors don't even know the right questions to ask.
That's right. And patients often feel, as my mother did, that if you say something, if you question the doctor at all, that somehow that you're being the bad patient, right? We saw Elaine on Seinfeld being fired by her doctor. And a lot of people have this idea that their doctor's almost like their parent, that the doctor may say, take this medication and you have to do it. Or you may not do it, but you're certainly not going to argue with the doctor. Mm-hmm. And so what I teach to my patients and to caregivers is that there is a way to do it. I mean, certainly you don't want to tell the doctor, you're wrong, you're stupid. I mean, you don't want that to be the message.
Right.
But there's certainly a good way of questioning the doctor so that you're getting the message across and you're advocating for yourself.
What was the reaction in the medical community to your book?
You know, I'll tell you that when I first wrote the book, and I had brought this to my department chair, and I thought, oh my goodness, what is he going to say to this book that's entitled "When Doctors Don't Listen"? Right? What is the response going to be? And I've been very pleasantly surprised, because doctors also see this as a problem as well. That we know that we are not delivering the best medical care that we can. We know that we can and should be doing better. And it's this frustration that patients have that's shared by doctors. And that's the frustration that we're channeling in this book to say, hey, we know that the system is broken, but here is what we can do so that we're helping patients help us. Right? And we're helping, we would love, for example, as doctors, to have patients who can come in and tell us what's going on. We know that, for example, the story of the patient's illness will help us determine what's going on 80% of the time. 80% of the time. That's better than any test out there. And so how much would it transform medical care if patients will come in and be ready to tell us what's going on with their illness? And so doctors have been surprisingly on board and surprisingly interested in the message of this book, because it helps them help our patients more.
Well, and just as your title of your book implies, the problem with patients a lot of times is the doctor runs in and doesn't act like he or she has enough time to listen to the patient's story, and that makes that's intimidating to the patient, and I think therein lies the problem. Is it because doctors are so overworked that they're trying to see too many patients in a day? What is the problem?
There is no doubt that doctors are under more time pressure than ever before. That because of billing and insurance companies, that doctors are under pressure to see even more patients than ever. But not only that, there are also more pressures on doctors' time when it comes to documentation. Every patient, I think, has experienced the computer in between the doctor and the patient. And the doctors, on the other hand, we feel like we now have all these check boxes that we have to get through in order to meet our requirements. And then there's the use of new technologies as well, that we now have so many tests and so many things that need to be done in order to fulfill our requirements too. And so what that ends up resulting in, though, is our patients feeling like they're not being listened to. And in fact, studies do show that doctors are interrupting patients in about 10 seconds after they start telling their story, which is really shocking. I mean, if you go to see your doctor says, what brings you to see me today? And you can interrupt it in 10 seconds. Mm-hmm. How much can you really get across? I mean, if you're trying to convince your boss to give you a raise, and you only have 10 seconds, I mean, that's a very short period of time. And so that's what we need to change. I'm
sure this was very unpopular with a lot of folks in the medical profession, was it not?
Well, doctors also do, though, experience that pressure. And when I speak with groups of doctors about this, doctors relate to feeling this unrelenting pressure from insurance companies and from other sources. And so what we are aiming for is we want patients to know, if you only have 10 seconds with your doctor, how can you convey your story in a way that gets them to listen? Nobody would argue that 10 seconds is not ideal. I mean, that's not the ideal thing that we should be doing for our patients. But if you know that that is the reality, how can you make the most use of that time? How can you practice getting that story? How can you ask questions in a way that will get your doctor to actually diagnose you correctly? That is what we're trying to get for, so that we can foster this better partnership between the patient and the doctor.
And we are back with Dr. Leana Wen, Dr. Kevin Kavanagh, and we've got a lot of plates in the air this morning. Kevin, go ahead.
I'm very, very privileged having Dr. Leana Wen on with us today. Let me just ask you, how big do you think this problem of conflict of interest is in medicine? How is this possibly tainting some of the recommendations doctors are, that a few doctors or some doctors are making to patients?
Well, let me tell you another story relating to my mother's illness. So my mother was someone who very much trusted her doctor. She grew up at a time when the doctor is this rigorous person, and for her, she had found an oncologist that she really liked, and when she was going through her therapy and her cancer treatment, she got along well with him. Now, one day, she lost her address book, and she needed to find his number, and so this was pre-Google, but typed his name into the internet to find out what his phone number is. And he had a fairly distinctive name, and instead of finding his phone number, she found web pages that talked about how he was a highly paid consultant for a drug company. She looked into it some more, and in fact, he was often a spokesperson for the very same chemotherapy regimen that he had put her on. And, this may still have very well been the right chemotherapy regimen for her. But knowing his conflict of interest and finding out this way made her wonder, and it made her doubt. And it made her think about what he's really in this for. I mean, is he really in this for her best interest or for his own best interest? Now, there are dozens of studies that show that drug company advertising, that drug company payments to doctors do, in fact, influence their prescription behavior, which is human nature. But it also speaks to why drug companies do this advertising in the first place. Drug companies spend more money on marketing and advertising than they do on research and development of new drugs. And drug companies will justify this by saying, well, we have to advertise in order for people to know about these drugs. But I would argue, if we actually have a life-saving medication, like the cure for cancer, the cure for AIDS, will there really need to be advertising? And so this got me interested in the transparency movement of having doctors disclose to patients about what it is that we're doing, right? Of what conflicts of interest might we have that would influence our prescription behavior and that might influence then the care that we're providing to our patients. I believe that it's the patient's right to know what those conflicts might be that may influence their health and well-being.
How did this affect your mom's opinion of her doctor?
She just really didn't know what to think. She would go into her office before, and she would accept whatever he would say because she thought that it was her best interest.
Did she ask the doctor about it when she realized he had a potential conflict? Did she bring it up to him or not?
No, there was no way that she would have felt that confidence to ask him about it.
Oh.
And that's why I fully advocate for doctors disclosing their conflicts themselves and engaging patients in a conversation about it. Because it does matter. Let's say that you're a doctor and you're getting paid for speeches for a drug company, or you're just getting paid for, you have a vacation that's sponsored by a drug company. That's very different than if you are a leading researcher who also happens to do trials for a new drug that's being produced. I mean, those are two very different things. And I think it's important for doctors to disclose it to their patients in advance, but also to engage their patients in a thoughtful discussion of what those conflicts might be so they can open the door to better conversations afterwards.
Well, yes, and I really would like to chime in on this. People need to realize that 90% of the new medications, according to Health Affairs, are just Me Too drugs. In other words, no substantial benefit other than probably costing more than what's already been on the market. And to push these drugs, a lot of marketing and marketing pressure goes into this. Patients can also look up, at least get some information on this from ProPublica's site, Dollar for Docs. Again, you'd have to Google ProPublica or Google Dollars for Docs, and you could look up in your area and your doctor. And I can tell you there's a physician in Lexington whose dollars are just out the wazoo that you really question whether or not things are appropriate. And that is different than, for example, if you're actually the developer of something. For example, I've had 3 neck operations. The third one, I was in a lot of trouble. I went to the gentleman who actually developed all of the neck implants down in Memphis. Excellent surgeon, very good results, at least as good as you could expect. You know, you had low expectations, obviously. And he was getting royalties in the eight figures, according to national news. But yet he's the gentleman who came up with everything, the mind behind it. He's not getting dollars to push sales. And so that's what you really need to be careful of.
And you knew to go to the guy that invented the thing. But see, I wouldn't have known that.
Well, yeah, that's true. Of course, I was also from Memphis and had some friends there, and checked out surgical skills by asking nurses on, when you have to redo an operation around nerves, if you come out with just a nerve that works a little bit, that's an excellent result. I mean, it's something that you have very low expectations on. And so, yeah, I mean, there are, if you're a world-class researcher coming up with innovations, doing clinical trials that are real clinical trials of new breakthrough products, that's one thing. If it's developing a Me Too drug or these clinical trials to just get doctors to use drugs, that's another, scheme. That's something to be avoided.
And in the event that you just joined us, Dr. Leana Wen is the Baltimore City Health Commissioner, and that is the oldest health department in the United States. She is our guest this morning, along with Dr. Kevin Kavanagh. Kevin?
Leana, let me ask you a question about medical journals and a research that doctors is based upon. The one thing that I've noticed is that this is becoming more and more a topic with editors of major journals. For example, The Lancet, which is the very, very prominent journal out of England, the editor there has stated that up to 50% of the research articles are rubbish, and that he really thinks that conflict of interest is at the heart of most of the problems. And then you compare that to New England Journal of Medicine, that is almost giving conflict of interest in a recent editorial a free pass, saying that this is something we have to live with. Industry, doctors getting along together spurs innovation, makes things better. And I was wondering if maybe you had an opinion on that debate.
Well, I think that this speaks to generally the issue of conflict of interest. That we absolutely the public has the right to know about what conflicts there might be that may influence a doctor's prescription to their patients, but that certainly also influence what are supposed to be impartial, fair scientists and their recommendations to doctors as well. And if there are significant conflicts, for example, if scientists are taking funding from the same drug company that they're supposed to be evaluating, then I think that just fails the sniff test, the common sense test that most people would have. One of the issues that scientific panels and journals are saying is that so many doctors do take money from drug companies and medical device companies, and so how will they find someone who is independent? And I think that is a reflection of where we have gotten to as a society, that we really need to be careful of these conflicts. And I'm of the belief that sunshine is the best disinfectant, as has been said by many individuals in the past, and that we need to have full disclosure, and that disclosure should have all the information for patients and others to make up their mind.
Yeah, and I think an example of that, you talked about disinfectants, is control of superbugs using this chlorhexidine that people are talking about. And when I look at some of that research, it seems to be tainted with not only conflicts of interest, which are declared, but that doesn't remove the conflict of interest, just declaring it. And you wonder if the results aren't overstated. For example, this may be a little complicated, but one of the points is that in one of these articles called the Reduced MRSA article, that this, showed effects of any pathogen, but any pathogen was actually a category, and when you look at that, there was only one pathogen of the commensal or the milder bacteria that appeared to be most affected. It's not saying it doesn't work, but just that this may be spun a little bit and maybe somewhat overstated. And then you also looked at trials.gov at this and had all sorts of changes in the study that were registered after completion date of some things being looked at later on and other things that weren't reported or not being looked at. And it really made one wonder what's going on here. And yet that was starting to drive through marketing, doctors doing different things. Many times a doctor in his busy practice doesn't have time to read the fine print of journals. They read the headline, they read the abstract, they get their information from other physicians. And if you really have to sit down for 14 hours to analyze one paper to figure out what's going on and where the conflicts of interest are and how this may bias it, that a lot of times it goes over people's heads. And it gets into sometimes a drug rep marketing scheme where all of a sudden a paper that doesn't have a lot of good findings is being made sound like it's just the greatest thing on earth and everybody needs to start doing it. And that's one of the dangers of, I feel, conflicts of interest.
So this is complicated, and there are things that we can do that are what I think are low-hanging fruit, which includes having doctors tell their patients. I think that's the most basic level that patients have a right to know about what decisions their doctors may be making that may influence their health and well-being. And I know that Dr. Kavanagh had mentioned ProPublica. There is also another website, the Physician Sunshine Act. It's part of President Obama's Affordable Care Act, and that there is a website on our government webpage as well, where you can look up your doctor's conflict of interest. And yes, it's true that maybe some patients don't care, and that's totally fine. Maybe it's true that some doctors don't care, also fine. But we want for patients who do care to have a way to find out about their doctors. What I've found as well is that when doctors know that their conflicts are going to be displayed for all to see, that many of them voluntarily give up some of these gifts or payments or other things that they may be getting from drug companies to avoid the perception of conflict of interest. And to me, that's great low-hanging fruit because that gets rid of some of the obvious conflicts, and also it is a step in the right direction. Is that enough? Absolutely not. But let's focus on the things that are the most immediately affecting our patient's health.
Yeah, and I remember even simple things. I remember one drug that was a combination proton pump inhibitor and antacid. Or you could go buy the antacid and Prilosec, which was the
same
drug
thing,
same thing,
yeah.
And take 2 pills. And if you took the 2 pills, it was like $20 a month, and the other one was like $100 a month or something. I mean, it was ridiculous. And then if the doctor prescribed that one pill, the patients would take it, and of course the cost of medicine goes up, but yet all you had to do was take the 2 separate pills. And a lot of times, if you look at things that way and try to shop around and you have a doctor that has enough time to find you an appropriate medication at the lowest cost, you'll go a long ways in saving your healthcare dollar because the difference can be tremendous. And especially now that patients have very high deductibles, sometimes $3,000, $5,000.
Right.
It's going to come out of your pocket.
Sure.
So you really do need to shop around, ask your doctor about expenses, and be very cognizant of costs.
I'm glad that you mentioned the issue of cost because that's something that we do not learn in our medical training. And yet, cost matters so much to our patients. What's the use of this amazing medication if our patients can't afford to take it? And many times, patients will not tell their doctor that they can't afford to pay for medication or may even not know how much the medication will cost until they go to their pharmacy to try to get it filled. And so it is important for doctors to understand that there are many financial barriers to patients getting the healthcare access that they need. And it's important for us to engage in a conversation about cost and not shy away from cost because it actually factors into what determines our patients' health outcomes too. Yes, we want to be prescribing the best medications, but only if our patients can actually take it.
I want to give a plug to my doctor since we're talking about some of these doctors that aren't so great. I have the greatest physician ever. His name's Dr. Larry Burns, and we have had discussions about different medications, and I remember Dr. Burns saying, this stuff is really expensive, and we might be able to get the job done with this. And that's wonderful, to be honest.
Well, yeah, and sometimes the difference is between taking a pill twice a day or 4 times a day versus once a day, and the difference is maybe $100.
Yeah.
So you've got to be very cognizant of costs. And also, remember that Kentucky has about twice as high of rate of antibiotic usage as California, and even in California they're overutilized. A lot of times you don't need the drug in the first place.
We are back. Dr. Kevin Kavanagh is in the studio with us, and we have Dr. Leana Wen on the phone, and she is the Baltimore City Health Commissioner. And I have a question for you, Dr. Wen, and that is, do you remember what you were doing on the 15th of April, 2013?
Absolutely. It would be extremely difficult to forget. I was working in the ER at Mass General Hospital in Boston on the day of the Boston Marathon bombing. And it's one of those experiences that you'll never forget. As much as we prepare for something like this, as much as we spend our whole lives in our medical training preparing for an event quite like that, you never know until it happens. And it's something that was so visceral and affected all of us in the city so much. And I think that during the unrest in Baltimore, it was a similar situation as well, that we could, as much planning and preparedness as we can do, we can never fully prepare for something that's quite so stark and quite so frightening for all of us as a city.
When you were in the ER in Boston, when the first casualty started to come in, were you aware of what had happened, or tell me exactly what happened that day?
There's so much that happened, and I would say that bringing it back to the unrest in Baltimore as well, it was similar when this happened in Baltimore. We, on the day of Freddie Gray's funeral here, we had thought that something like this could occur, that there could be protests or riots. But as we began hearing on that day in Baltimore about the pharmacies that were being burned and looted, about protesters and rioters who were burning cars, we worry about safety. We worry about the safety of our staff who are out there in the field. I mean, in the health department, we have hundreds of people who work in the field as wound health nurses, visiting people in their homes who are pregnant women, who are seniors, and helping them with home care. We're worried about their safety, but then we also worried about the safety of our residents and how can we deliver services to our residents in a time of need. Many of the residents in the city, for example, depended on the pharmacy near them for their medications. We were hearing about people who were going without access to their insulin, who were literally dying because they didn't have their blood thinners and without their blood pressure medications. And people also relied on their pharmacies for food and for other supplies. And so for us in the city, it was about recognizing the immediate needs, helping to ensure safety, but then coordinating with our other city agencies under Mayor Rawlings Blake's directions and with our state agencies as well, so that we can protect the health and safety and respond to the immediate and ongoing needs.
Dr. Wen, you began this program by saying Baltimore, depending on your zip code, which I thought was just an amazing way to put it, your life expectancy is based on your zip code. How can we fix that?
This is never an easy issue because there are so many different things that contribute to poor health. But then we also cannot say that it's too complicated, because if we say it's too big of a problem, we'll never get anything done. So what we focus on is 3 things. The first is we're focusing on youth health and wellness. The future of our population, the future of our city depends on having children who are born healthy, who are then ready to thrive, who are ready to grow. And so we are focusing on, for example, reducing infant mortality. Since 2009, when we had the 4th worst infant mortality in the country, as a result of gathering our agencies to work together, of forming coalitions within the city, we've been able to reduce the infant mortality in Baltimore to the lowest that it's ever been. But there's so much work that has to be done to promote health among our children. The second is substance abuse and mental health. Heroin is an epidemic here in the city, just as it is in many other places in the country. And we have to focus on the heroin epidemic, on improving treatment, and improving access to services for both physical and mental health and addiction. And the third is caring for the most vulnerable, that even as we have new advanced technologies and new treatments, that we cannot forget that we have to focus on individuals in the city, in our communities, who are the most vulnerable, who are the most in need. So focusing on our seniors, on our babies, on those who need that extra boost in order to raise the playing field and to level the playing field. That is the job of public health. That's the work that we have in front of us.
How can I get a hold of a copy of When Doctors Don't Listen? Is it available everywhere?
Absolutely. You can buy When Doctors Don't Listen on Amazon. You can buy it in your bookstore on Barnes & Noble. And the key is that there is something that each of us can do, each of us have to do in order to advocate for ourselves, in order to advocate for our loved ones, for our families. And that is the key reason why I wrote that book, so that we can help our doctors best help us.
The thing that has stuck with me more than anything you've said this hour is the average time spent with a doctor with their patient and allowing them to describe their illnesses, 10 seconds. And I can't think of any other service, whether it be going to get your car fixed or your plumbing worked on or any kind of service you can think of, that would even possibly be acceptable. I'd just go get a new plumber. If the guy said, look, I'm busy, give me 10 seconds and tell me what's going on here.
I think the one trend that we see in public health is the same one that we see in patient care, which is that our health is the most important thing. And the time for us to be focusing on our health isn't when you're dying of a heart attack or that you're suffering the effects of a stroke. The time to care about our health is now. We have to focus on prevention, on healthy lifestyles, on getting access to affordable medical care. And we also have to focus on these other, what we call social determinants of health, focusing on our education, focus on housing, focus on poverty, because these are all issues that contribute to health and well-being. And that's the mission in front of us in public health and in medicine.
Dr. Wen, I can't tell you how much we appreciate you being with us. We're lucky to have someone like you. Thank you very much for being with us.
Thank you.
Thank you.